Hey everybody, this is Dr. Austin in NoHo Chiropractic. I'm going to go over a case today that I think is unique and kind of sets us apart from the average chiropractor. The ability for us to take x-rays in-house is a major key that we use for our diagnosis consistently. So we have it here in this room. We take our patient's back. It takes just a few minutes to get an appropriate image. So this patient here on the screen, they came in with 13 years of low back pain. They'd seen a million specialists and they saw our reviews. They wanted to come in and get treated. In the examination, something didn't sound particularly right. There were no red flags, but when I went in and touched the low back, it didn't move like a natural low back. So instead what we did was we took x-rays to see what was going on underneath. So I'm gonna cut to the x-ray screen so you guys can see a little bit of what I'm seeing. Now you don't have to be trained in x-rays to get the idea that we shouldn't look like one big rod coming up. In a normal spine, what we should be seeing is separation between the levels. This is the side view of the spine. But there should be a separate blocks building up the spine, not one unit. This patient, over the past 12 or 13 years of back pain, has actually been fusing his spine together slowly over time from the bottom up. And when he came to me 13 years in, it had gone as far as all the way up almost to his neck, okay? This is the type of patient that we can't adjust because that patient could wind up being hurt if we do actually move the joint. Instead, they should have had imaging 12 to 13 years ago, gotten ahead of this problem. That way they could have maybe intervened before everything had fused together. In contrast, you can see this is where the spaces used to be, and now all of the bone has developed to fuse the whole spine together. What we're looking at here is all of the ligaments and tendons have started to calcify along the spine, including the SI joint. So everything from here to here has been fused together and is now essentially one big rod. So we did not do any treatment for this patient. We would have been able to adjust the upper portions of the spine, but instead I sent him to a specialist to do some specific blood testing. What likely we're seeing is something called ankylosing spondylitis. It is pretty rare, and there's a blood test you can do to see if you have the gene that it typically presents with. So I know this isn't a social media extraordinaire situation where we get these big reactions, but I think it's important to see that here at NoHo Chiropractic, we have a high diagnostic skill as well. We spend a lot of time looking at patients and what's going on with them, and we find this sort of thing more frequently than you would expect. It's because we have a great patient base that refers us all of their friends with tough problems, and we're able to sit here and solve it, whether it's on our own or referring to the appropriate doctors and working as a unit.